This month marks 5 years since COVID was declared a global pandemic, changing nearly every aspect of our lives. While the number of cases has drastically fallen, some who still contract the virus are having symptoms that last weeks beyond testing positive.
Now, those prolonged symptoms are often called long COVID, and it's often difficult to communicate the impact to healthcare providers.
But for the past 4 years, a clinic dedicated to identifying and managing long COVID clinics have worked to help patients return to a normal life. NBC4's Sierra Johnson visited a doctor who was working to understand the illness.
Yeah, that's exactly right. Brain fog, exhaustion, a shortness of breath, those are just a few of the currently known symptoms of long COVID. But according to the team, the post-COVID recovery clinic, there are nearly 200 symptoms, and the work of understanding the why is just getting started.
We were on the front lines of the acute COVID epidemic, and so I would go to the hospital and we would be taking care of patients on ventilators, patients on high flow oxygen.
Like so many healthcare providers, Dr. Andrew Seamus witnessed firsthand the impact of COVID-19. And his up-close view of the virus and its impact on the body continued even after the world began to reopen, kids returned to school, and those mask requirements were lifted.
Patients who'd survived the initial infection got online in social media and started comparing notes.
The patients he's referring to, those who even weeks or months after initially testing positive had lingering symptoms. Among them, according to Dr. Seamus, shortness of breath, cough, or overall body symptoms like chills, fever, and prolonged exhaustion.
Normally, when we take care of patients with blood pressure or diabetes, we have a pretty good roadmap of how these patients should be cared for. With long COVID, there was no roadmap.
But in 2021, seeing the increase in patients struggling to communicate the symptoms to their physician, the post-COVID recovery clinic was created. That team, including Dr. Seamus, worked to find a plan that addresses an individual's unique combination of symptoms. That treatment could include cognitive rehabilitation, medication, or breath training.
It's not the same as having a cure, and there really is a desperate need for studies that uncover what's causing this and how can we treat it more effectively.
And those at the clinic say there is a steady stream of patients seeking medical care. They are also in need of participants for clinical trials for treatment. We, of course, have a link to those resources on our website, NBC4i.com.